Have you ever stopped to think about, well, the invisible battle that's happening right now, all to protect us from something like the flu? Seems common, right?
Yeah, most people, they get their shot. Maybe they're a bit more careful in winter, and that's kind of it.
Exactly. But behind that, there's this huge, incredible global effort. Understanding the flu, tracking it, fighting it. And that's what we're diving into today.
It really is so much more complex than just getting a jab. And for this deep dive, we've looked at insights from, the big players.
Like who?
Well, the World Health Organization, the CDC, but also research places like the Francis Crick Institute, St. Jude Children's Research Hospital, plus some really interesting new scientific papers.
Okay, so our mission here, for you listening, is basically to give you the inside track. A shortcut to getting up to speed on how the world actually gears up to fight the flu.
Yeah, what does it really take to stay ahead of a virus that's, well, constantly changing shape?
Let's unpack that. It's like this high-stakes global strategy game. Where do we even start?
Well, you really have to start with the World Health Organization, the WHO. They are absolutely central to this whole thing.
The nerve center, you mean?
Pretty much. They play this crucial role in monitoring flu viruses all over the planet. They're kind of the foundation for the whole global watchtower, if you like.
And that foundation has a name, right? Something like GISRS.
Exactly. GISRS, the WHO Global Influenza Surveillance and Response System. And get this, it wasn't set up yesterday. It dates all the way back to 1952.
Wow, 1952, so it's well established.
Definitely. It's this huge network, more than 150 labs and institutions globally. You've got national influenza centers, WHO collaborating centers. It's vast.
And what's their day-to-day? What does this network actually do?
Their core job is just constant vigilance, nonstop. They do virological surveillance nationally, testing hundreds of thousands of clinical samples every single year.
Hundreds of thousands, yep.
Think of it like a global detective agency hunting for flu viruses. They're identifying new strains, tracking where they pop up.
So both the regular seasonal flu and the potentially scary pandemic ones.
Both. Absolutely critical for spotting danger early.
Okay, so all that data, that must feed into the vaccine decisions we hear about, right?
Yeah.
How do they go from, lab samples to saying, okay, these strains should be in next year's shot?
That's the key step. The WHO holds these technical meetings twice a year. February for the Northern Hemisphere's vaccine, September for the Southern.
And they just review everything.
Meticulously. They pore over all that GISRS data and make recommendations for the specific strains to include in the seasonal vaccines. The goal is always to target the viruses they think are most likely to be circulating.
It sounds like trying to predict the future, almost. A moving target.
It absolutely is a fast-moving, shape-shifting target, and the stakes are incredibly high.
So once they decide which strains, how do they actually create the basis for the vaccine? The candidate viruses.
Right, good question. WHO works on developing those candidate vaccine viruses too. There are two main ways they do this. First, there's what's called classical reassortment. That technique's been around since '71. It's like mixing different flu viruses together and letting them swap genetic bits to make a safe vaccine strain.
Sort of like controlled breeding for viruses.
Kind of, yeah. And then there's reverse genetics. That's much newer, a patented technology.
More high-tech.
Definitely. It allows scientists to be incredibly precise, almost like surgically inserting genetic instructions to build the exact vaccine strain they need. It's especially useful for making dangerous viruses safe for vaccine production.
And all this work, the surveillance, the vaccine stuff, it falls under one program.
Yeah, the Global Influenza Program. They provide the overall strategy, technical support, coordination, helping countries get their health systems ready for, well, any kind of flu threat, equipping the world, basically.
It really highlights how much this is about dealing with change, doesn't it? You mentioned the virus constantly changing.
Absolutely. Influenza is a master of disguise. We talk about two main kinds of change. There's antigenic drift.
Drift sounds gradual.
It is. Minor changes. Think of the virus tweaking its appearance just slightly, enough so our immune system doesn't recognize it perfectly from last time. That's why we have seasonal outbreaks year after year.
Okay, that makes sense. But then there's the other one, antigenic shift.
Ah, yes. Antigenic shift. That's the big one.
Big how? What happens there?
That's a major change, a complete overhaul almost. It often happens when different influenza subtypes swap large chunks of genetic material. Like, imagine a bird flu virus mixing genes with a human flu virus.
Oh, okay. That sounds not good.
It can lead to a completely new strain that human immune systems have basically never encountered before. That's where the potential for big epidemics or even global pandemics comes from.
So that constant adaptation is why the surveillance, the GISRS network, is just so vital, trying to spot those shifts before they cause havoc.
Exactly. It's a biological chess game, trying to stay one step ahead.
Okay, so WHO is the central command. But there must be other players, right? Specialized research centers doing cutting-edge work.
Oh, absolutely. Beyond the main WHO network, you've got places doing incredibly focused work, like the Francis Crick Institute in London.
What's their role?
They run one of the 7 big WHO worldwide influenza centers. They analyze flu viruses from all over, helping monitor strains and informing vaccine choices. They do a lot of what's called genomic surveillance.
Decoding the virus's genetic blueprint.
Precisely, understanding exactly how it's evolving. And then you have places like St. Jude Children's Research Hospital in the U.S.
What's their focus? Antivirals.
Exactly. They dig deep into how the virus copies itself, replicates, and crucially, how drug-resistant strains pop up.
Which is super important because antivirals are often our first line of defense, right? Especially if a new strain appears quickly.
They are vital. St. Jude's work helps guide the development of new, hopefully more powerful antiviral drugs.
And speaking to developments, what about this idea of a universal vaccine? Something that protects against many strains, maybe for years.
Ah, yes, the Holy Grail. That's a huge area of research. Moving beyond just matching strains each year, organizations like CIDRAP track all the potential candidates.
So is it just a dream or are we getting closer? What makes it so hard?
It's incredibly challenging. Most current vaccines target a part of the virus called HA, or hemagglutinin. It's like the virus is key to get into our cells.
But that part changes a lot, right?
Yeah.
Antigenic drift.
Exactly. That's the problem. So scientists are looking at other, more stable parts of the virus, things like neuraminidase or M2 protein or nucleoprotein. Think of them as the virus's internal machinery or structure.
Parts that don't change much.
Much less. So the idea is if you can train the immune system to attack those parts, you might get broader, longer-lasting protection, maybe even universal.
How are they doing that?
Using really advanced strategies, structure-based antigen design, nanoparticle displays to show the immune system multiple targets at once, sometimes higher antigen doses, new adjuvants. Those are substances that boost the immune response.
It sounds incredibly complex. I heard something about using computers to predict the flu's evolution, too.
Yeah, there's some fascinating work there. A method called Beth1, mentioned in Nature Communications. It's basically using computational models to predict which specific mutations are likely to help the virus succeed.
Like getting a weather forecast for flu evolution.
Sort of. It tries to figure out which tiny changes in the virus's code will give it an edge, helping researchers anticipate which strains might become dominant and design vaccines proactively.
So where are we with these next-gen vaccines? Are any close?
Well, there are multiple candidates moving forward. Nanoparticle-based ones, mRNA vaccines. Several are in early-stage clinical trials now, so it's definitely moving beyond just the lab bench.
That's exciting. Feels like real progress.
It is, but the big caveat, none are actually licensed for use yet. Still a way to go.
Right. And it's not just the vaccine itself, but how it's made.
Correct. They're also innovating manufacturing, things like using plants to grow virus-like particles, VLPs. These platforms could potentially be much faster than the traditional method of growing vaccines in eggs.
Which would be crucial if a pandemic hit, needing rapid production.
Absolutely. Speed is critical then.
Okay, so that's the lab science, the future tech. But how does this all connect back to what actually happens out there? With real people, real flu seasons. Let's look at the epidemiology.
Yeah, bridging the gap from the lab to the real world is key. And we're getting some fascinating insights. There was a recent preprint beginning of June 2025 in eLife.
What did that show?
It looked at H3N2 flu and showed something really interesting about immunity. It's not just about whether you're immune, but how your individual antibody immunity varies.
Right.
Meaning the specific gaps in immunity across a whole population actually shape which flu strains manage to take hold and spread. Your immune history and your neighbors and everyone else's. It creates pathways for the virus.
So our collective immune landscape steers the virus's evolution.
In a way, yes. It influences which strains succeed. It's a powerful reminder of how interconnected immunity is at a population level.
And that deep understanding that informs the very specific vaccine choices, like the ones WHO just announced.
Exactly. You see the direct output. For the upcoming 2025-26 Northern Hemisphere season, they recommended specific strains. Like for H1N1, it's an A Victoria 4897-2022-like virus. For H3N2, it's Acroatia 10136 RV 2023-like if it's made in eggs, or a slightly different one if cell-based.
Yeah.
And a Bostria strain for the B Victoria lineage.
Super specific. That's the surveillance paying off.
That's the goal. And we see interesting patterns in real-world data, too, like that study from Chengdu, China, looking at 2019 to 2024.
What did they find?
They saw influenza A was dominant before COVID-19 hit, and it came back strong after. But interestingly, influenza B seemed a bit more resilient during the pandemic years.
Huh. Why would that be?
Hard to say for sure, but it shows how different flu types can react differently to massive disruptions like a global pandemic altering travel and social mixing. Gives us real-world context.
And speaking of real-world threats, the avian flu situation, H5N1, still a concern.
It's definitely still on the radar. There's a specific clade 2.3.4.4b that experts like Wendy Barclay at Imperial College London are watching closely.
She had a pretty vivid description for it, didn't she?
She called its genetic mixing viral sex on steroids, which certainly grabs your attention. This strain has picked up mutations that seem to help it replicate better in mammals, including cattle, pigs, even human cells in the lab.
But human-to-human spread is still rare.
Thankfully, yes, human cases remain rare and sustained transmission isn't happening, but the monitoring is intense. And importantly, vaccine seed strains have been developed, and we have antivirals ready just in case. Preparedness is key.
So in all this effort, how well did the last season's vaccine actually work? Do we have numbers?
We do. The CDC released interim estimates for the 2024-25 season. For kids and teens, vaccine effectiveness was around 32-60% against needing outpatient care, and higher, 63-78% against hospitalization.
Yeah.
For adults, it was about 36-54% effective against outpatient visits and 41-55% against hospitalization.
Okay, so what does that mean for you, the listener? It's not 100%, obviously.
No vaccine is. But it means they offer moderate protection against getting sick at all. Where they really shine, though, is in preventing severe illness, significantly reducing your chance of ending up in the hospital.
That's the key takeaway, isn't it? It might not stop every sniffle, but it's very good at preventing serious outcomes.
Absolutely. And that ties directly back to public health. Reducing hospital admissions is huge. It eases the burden on the whole healthcare system, frees up beds, saves lives. It shows the direct impact vaccination has.
So, wrapping this up, what we've really seen today is this incredible layered global machine working constantly against the flu.
Yeah, from the worldwide surveillance networks listening for viral signals to the labs pushing the boundaries of vaccine tech, it's a never-stop effort.
A dynamic battle against the virus that just keeps changing the rules. It's pretty awe-inspiring, the scale of the collaboration.
It really is. And hopefully understanding a bit more about these efforts helps you appreciate the science that goes into protecting public health and how we prepare globally.
Definitely. It leaves us with a final thought, something for you to chew on. Given that influenza viruses are always evolving, always throwing curveballs, what do you think is the next big thing we need?
Yeah, what's the biggest technological leap or maybe a public health strategy that's still missing? What do we really need to finally get ahead of seasonal flu and stop the next pandemic before it starts?